I'm joined now by our Medical Officer of Health, Dr. Paul Roumeliotis, for the latest on COVID-19 in our region. Welcome back, Doctor.
Good to be back.
All right, so on the weekend, the health unit did release a press release that testing has now been expanded to everyone.
Yes. And this is something that we saw it coming. It's something that indeed that I had wanted to do, and the timing, the timing was right because you want to now expand your testing as we're opening up. So you want to make sure you test people as we're opening up to give us a better idea of what's going on. And right now, I'll just explain a bit. Yes, we're testing everybody whether they have symptoms or not. Obviously, if you have symptoms, we're going to test you. In the past, we were only testing those who had symptoms, but now anybody who feels that maybe they were exposed or wants to get tested can get tested without any symptoms. I want to also clarify that if I test you today and you're negative today, it doesn't mean that you won't get it tomorrow. You won't have it tomorrow. So if just because you have a negative test does not mean that you won't get it, in a couple of days. So if you have a negative test and you get sick, don't assume that it's not COVID. We can test you again. So that's the very important part. The other thing is that there's some people that are worried and want to get tested every day. That shouldn't be done either. We should be limiting the testing. If you get tested once and you have no other reason to get tested again and you're fine, there's no problem. The reason we're doing this testing as well really is because as we're opening up things, activities and businesses, it's important for me to know what percentage of the population has the virus and doesn't know it. Now we understand that there is a proportion of the people who have it and don't even have any symptoms at all, have very mild symptoms, don't even realize they're sick. So what's that percentage? Is it 10%, 20%, 30%? I'd like to know. So as we're testing people randomly, so to speak, in other words, without any symptoms, it's important for us because it'll tell us the amount of people that have the COVID virus that can be potentially shedding it in the community, but at the same time don't have any symptoms. So it's very important for us to know that as well. We'll also be keeping an eye on the number of cases that develop in our community, the use of hospitalization, and all these other measures. They're going to continue. So it's quite important for us to understand, the why we're doing the testing and the limitation of the testing as well, that if somebody tests negative today and tomorrow they're exposed, a couple of days later they can develop it. So I just wanted people to understand that clearly, and that, again, we're telling people to wear masks when they can't self-isolate or self-distance, like the 2-meter distance. And the reason we're saying that is because we're assuming that people may have the virus and not know it. So that's why we're telling people to wear face coverings when they're going to tight spaces and they can't, socially distance and all these other things. So it'd be nice for us one of the things that's important for us, not nice, it's actually scientifically important for us to be able to determine what percentage of people are actually carrying the virus and don't know that they are.
And I think indicative of that, Doctor, is the fact that the last 2 cases that we saw were community-based transmission with no other connection to any other cases.
Exactly. So that's a very important number for us to know, an important notion for us to understand, that if it's in the community and somebody doesn't remember, no, I didn't have a contact with anybody who was sick, for example, and all of a sudden you get it. It tells you that somebody you knew or somebody you were in contact with had no symptoms and was saw you or something like that. So that underscores the importance of keeping the physical distancing, because we know that even if, let's say I have no symptoms but I do have the virus, theoretically I can shed the droplets that when I'm speaking out or breathing out up until 2 meters. So even if I'm asymptomatic and have COVID, but you're like more than 2 meters away, you're not going to get it. But if you come closer to me, you might get it. Or if I sneeze onto a keyboard or whatever, and I don't even know that I have COVID to begin with, and then you touch the keyboard and touch your nose, you've infected yourself. Both of us not knowing, right? So that's why it's important to have the physical distancing, washing your hands, doing the disinfection, and wearing the mask when you can't physically distance. And our testing will just add some more information to us as to how important asymptomatic or transmission of the virus with people without knowing it to others.
And that just underscores the importance, as you just alluded to, of continuing up measures, even as the reopening process happens. It's so important. You alluded to on certain press calls that businesses are responsible for making sure measures are in place, but shoppers have that responsibility as well, that even though our numbers here are relatively stable, that's a testament to what we have been doing and need to continue to do.
Yeah, and you know what I call it? I call it the key to the next stage is continuing what we're doing, continuing our precautions, continuing to collectively keep that curve flat, keep a couple of, keep the cases coming, at a low level. And that's the key for success to opening up to the next level of having more people gather and having more, going back to more normal. It'll take a while, but at least we'll progress, and that's the key.
On that note, Doctor, thank you so much for joining me for this update.
No problem.